Today, we are very excited to have Dr. Saul Axelrod on the podcast. He is the professor emeritus at Temple University and been involved in the field of ABA for quite a while now. So we're going to have a lot to learn. Hi, welcome.
Well, thank you. I'm glad to be here. I'm honored to be here, I should say.
Oh, wow. The honor is ours. We actually met you over the time that we were in Philadelphia for ABAI. We had a lovely dinner together. And we felt like, you've had so much experience in the field and have so much to share. And I'm sure our audience would just love to tap into some of that. So we're very excited to have you.
I'm pleased to be here.
If you could start by telling us, introducing you to our audience, telling us a little bit about you and your background. I know this is probably more than a few minutes, but give us the synopsis.
My background goes very far back. Well, actually, my entry into the field of applied behavior analysis was kind of circuitous. My undergraduate degree was in math, and when I got out of undergraduate school, I worked for 4 years as a computer programmer at General Electric at the Missile and Space Division, and I found it very unsatisfying, and I decided I wanted to change fields, and the more I looked at it, I wanted to go into the field of psychology, and Florida State University accepted me, even though I didn't have a psychology background, I think because of my mathematics background. And at Florida State, I was introduced to some very strong applied behavior analysts. And from that point on, I was a behavior analyst. I was introduced to a lot of theorists at that time, and they're all interesting, everything from Hull to Freud. But when I heard the discussion of Skinner, I was mesmerized, and I've been a behaviorist ever since.
That's an incredible story from mathematician to psychologist.
Yes.
Oftentimes I'm like, oh, well, what would it be like if I was in a totally different field? And I've never done it because I've just loved psychology so much. I've loved ABA that I haven't switched.
Yeah. Well, in my case, though, the fact that I was going into a field that was so data-based and experimental design oriented, actually, my mathematics background, at least the logic that came from it, was actually useful for designing studies and measuring behavior. And I didn't feel like I was leaving my mathematics background by being in applied behavior analysis. And now it's even more so. And there's a lot of people doing meta-analyses. And so being in math is actually pretty good preparation for ABA.
Tell us a little bit about when you first started in ABA, just like what sold you on the field? I mean, there's so much there, but what was your first experience? Was it the professor? Was it a student you worked with?
It was a professor, but it was also, after my master's degree, I took off about a year and then went back to Florida State. And I had a job working with severely retarded, mentally disabled children. They were very low on the scale. And they really had more potential than they were being credit for. This is an institution. They were kept inside in really with their cribs, I guess it was, but they were enclosed a lot. We felt like they could do a lot more than they were doing. And we worked on self-feeding programs, amazingly easy to do, because all you have to do is have a hungry kid and put a spoon in her mouth, and she pulls it up very quickly. So that was a reinforcer for me. Okay, really something has taken place. And the next thing I worked on was teaching kids to walk. Now, ordinarily, kids will walk without being trained, but these kids were so incarcerated in their environment, they never developed the skills. So we picked 6 kids who we thought we could teach to walk, and it took us a long time. It was about 6 months before the first one could walk, but we got 4 out of 6 to walk. And I thought, if you can do this with ABA, there's a whole lot you can do with ABA. And I immersed myself further into it. My dissertation at Florida State was an ABA dissertation. I compared individual and group contingencies, and the study got published, so that was a reinforcer for me, thinking I wasn't really sure at that time, but then I decided to go into academia, and having a couple of publications made it easier. Also, when I was at Florida State, the University of Kansas was a major center for applied behavior analysis. And there was one person's work there that I really appreciated. And I appreciate everybody's work there. They're mostly working with people with severe impairments, and they were teaching great skills. And a lot of the people had a connection to the University of Kansas, either then or at some point in their career. And I was again, I was mesmerized by the field, but there's one person's work who was really grabbed me, and that was Vance Hall. And I just out of the blue, and there was no notice or anything like that, just out of the blue, I wrote to Vance and said, I introduced myself and I said, look, I'm finishing up my doctorate at Florida State. I've read your articles. I'm really impressed with them. Is there some way I could do a postdoctorate with you? So I heard from him about 10 days later, and I was nervous just hearing his voice. And he said to me, I don't know what a postdoctorate is, but I'll look into it for you. So, okay. So it meant another year of poverty, but, I thought it'd be a good way to start. And so he invited me up there for an interview, and we're having a really good discussion. And he said, what do you want to do in this field? So I said, my main interest is really mainstream populations, but I know the field is oriented to people with disabilities. And I said, what my career goal is to devise interventions that teachers, not just special ed teachers, all teachers can use in their classroom that will be convenient and powerful and give them immediate outcomes. And Vance said to me, okay, you're hired. So, because that's exactly what his career was involved in. And so I did a postdoctorate with Vance. It didn't last a year. At some point I had to get a real job. And so I did a postdoctorate with him. I was very fortunate. He had a lot of data that hadn't been written up yet. He was so busy he couldn't do it himself. And he sort of gave me some, would you be interested in trying to write these articles up? And said, yeah, certainly I'd be happy to do that. And so we had a very good connection. We stayed close for years. Vance made it to the age of 95. He died only a couple of years ago. And his children had a loving joint session for everybody. It was really great honoring him. But just to brag on Vance a little bit, he had the first article in the first issue of the Journal of Applied Behavior Analysis, an honor that only he will have. And so my first full-time job was at the University of Connecticut. It was paid for by a grant, and I was the only behaviorist there, and I did pretty well there. I was in terms of teaching and publications, but they really did not want a behaviorist there. They were, I think, intimidated by behaviorists, and so I got a job at Temple, which really turned out beautifully for me, not just professionally, but personally, because I'm from Philadelphia area. And so I went back to Philadelphia, and my children got to know their grandparents, which was a huge thing. And I'm still here, and I'm fortunate my children and grandchildren are still here. And the Temple job was just spectacular from beginning to end. I started out in special ed, and I was in special ed for my whole 40 years at Temple, but about maybe 15 years into it, I developed an applied behavior analysis program with Phil Heinlein in the psychology department, and that program is going very strong. Phil and I have retired, and the young faculty now are awesome. They're doing a great job. So
Wow,
that's some background for you.
that's awesome.
Incredible. Oftentimes we talk with, newer BCBAs or, not even BCBAs, but just people in general who are so scared to reach out to somebody.
Yeah.
And I don't know if that's because just the world today just moves so quickly, or if it's just because it's like, I'm scared of hearing the word no, or, in your mind, you build it up to be more than it is. And I think it's so awesome that just from a reach out, that really built your whole career.
Yeah.
And
I assumed nothing would happen, but it was, I have something I say with my children, my grandchildren, my wife. You always ask.
Yeah.
It's like whether you're trying to return an item or you're trying to get a date or whatever else. You always ask. Just do it, and more often the answer is yes than no. So you give it a try. I figured I'd try Vance, and he didn't know who I was, of course. And he called me, and we had a lifetime relationship after that, personally and professionally.
Yeah, it's how I met Shayna. Same, similar. And I think it's fascinating how much of your career has been in academia and teaching and building these programs. And I think it's so important in our field to have like the research base, but I think so many of us are more practical, clinical
Yeah.
behavior analysts. And I know it's often hard to like bridge that gap of like, we don't do both. You often pick one or the other, but what can we do better to bridge the gap between the research on the and the clinical, if you have a suggestion there?
Yeah, well, I mean, what I would tell my students when I was teaching a more general education program, I said to them is, look, you're very, very busy people. You're going to be teachers. It's going to be a very difficult job. My wife is a teacher. I know exactly what it involves. It's an incredibly difficult job. What I told my students when I had a sort of a general education class, I say, find one journal in your field that is practical. None of this philosophical stuff, nothing about how schools get funded, nothing about the history of American education. One journal that has teaching techniques in it. And all I want you to do is read the abstract. And then if there's something there that appeals to you, read the article. The first thing in intervening on behavior is to find out what other people did successfully. You're not a genius if you discovered something that was discovered 50 years ago. You're just lazy. So just open up a journal, see a practical journal, see what other people have done, and use that. Okay, so our field is very natural for the research and the practical. It's applied behavior analysis. So I suggest that people read the abstract of a journal. I know how complex the journals have become. In the beginning, when I was in graduate school, the Journal of Applied Behavior Analysis came out. I was so obsessed with it, I would read it that day, But back then, you could read it that day. It's not that easy to read it in one day anymore. It maybe takes you a month these days. But we have a field that is immersed in research. And so it's your obligation to look at it. And then take just enough data to indicate whether your intervention is effective or not. So you look for these procedures in the journals, see if they're helping you, then take just enough data to see if you're not doing it. If you're not doing a study, if it's not your master's thesis or doctoral dissertation, you don't have to do as many things as required otherwise. Just take some data to see if it makes a difference. And a funny thing that would happen to me early in my career is, we have research designs like the reversal design. So you take baseline on a behavior and you have an intervention. And some people will say, stop there. And so when I was at Florida State, I was teaching a class, and I said, okay, all you have to do is take baseline and then intervention. And my students started saying to me, how do we know it was the intervention that worked? They were doubting their own research. I said, okay, go back to baseline conditions. It's not so much for the field, it's to convince yourself. If you're applying an intervention, it's usually a lot of work. And if you don't need it, you want to get rid of it. But if you see that during baseline, this behavior was in bad shape, during intervention, improved a lot, but how do I know it was my intervention? Okay, take a couple of days to go back to baseline. Usually the behavior falls apart very quickly. Now you're convinced, and now you're going to do it, and now you can disseminate it to other people. Tell other people, look, I knew this works. It wasn't happenstance. It was our intervention that did it. So, you don't have to do as much research as you would do for a published study, but you do have to do enough research to convince yourself that your intervention works.
Yeah, I love that. I think you're saying like, if you're not reinventing the wheel, then you can
Right.
rely on research, rely on strategies
Yeah.
that have already been effective. You don't need to reinvent it with our clinical application. You just need to know for yourself that what you're doing is working, which is so true.
So one of my goals in my career was to devise, going back to my discussion with Vance Hall, to devise interventions for teachers that were powerful, inexpensive, and very effective. And I thought I could do that. I found out I didn't have to do it, because what happened is that my students, they were at Temple, the graduate students or part-time students, they're usually teaching during the day, taking courses at night. My students started devising all these interventions for me. And it's like, I just shake my head. Where did you get this from? This is an amazing procedure. So I ended up, I had a publication. It wasn't, it's just something I would hand out at the 25 procedures to get your classroom under control. Almost all of them came from my students. And when I wrote my first book on classroom behavior modification, many of the studies were done by my students. And talk about a reinforcer.
Yeah.
Students were just ecstatic to see their name and their study in a published book.
But also for you, talk about just like a measure of whether or not what you're doing is working. Your students are engaged. They want to do things and they want to be a part of this. And I think that's wonderful.
Well, I'll tell you another story about that, is that this is my second marriage. It's been going on about 30 years now. And earlier in my marriage, we invited the graduate students, the ABA master students, for a party at our house. There were probably 20 students at the time, and some of them brought partners, some of them didn't. So we had this party in there, and my wife, who's a very enthusiastic teacher, said she had never seen people like this. The animation in the room, all people are talking about is applied behavior analysis. I had a kid who was doing this, So when I started out, the emphasis was typically on getting classrooms under control, but quite frankly, those are the easier problems. By this time, it was about teaching new skills, typically people with disabilities. And the room, our living room was just filled with people, animated people talking about this. And Kathy just said, I've never seen anything like this. And people weren't complaining. They were, frequently when teachers get together, they're complaining. These are ABA people. They were not complaining. They were only talking about the amazing interventions that they were using and getting great outcomes with.
That's
I'm a
awesome.
teacher turned BCBA, so I can definitely kind of relate to both those sides. And I work at a school now, and I love working with teachers because they bring so much creativity and so much motivation and passion and relationships with the kids. And then we get to like complement it with like the technical stuff, like, okay, the reinforcement system is going to work in this way, or the technical things. But it's based on their so much that they bring to the table, and it's such a good complement.
Absolutely. So I just thought of another thing about my experience with Vance. When I interviewed at Juniper Gardens Project, he had published this article, the first article again, about giving kids attention when they behave appropriately, and if possible, ignoring them when they behave inappropriately. So I believed it, but I was walking through a school with him, and he sees two kids sitting at a desk doing their work. He leans over, puts his hand on the desk, and says, "You guys do nice work." He just saw these two kids light up, and I said, "Hey, this is the intervention. This is really great. No yelling at them, no telling them you misbehave, you get a detention." Just looks at them. I was a little nervous actually the way he walked up there and put his hand down on the desk, and he said, "You guys do good work." And these kids just collapsed into it, just ecstatic about it. And that
As you're saying that,
uh,
as you're saying that, I'm thinking like, wow, there's so many principles that we probably take for granted now that are, just, we almost see them as fact that were being discovered probably as you were going through
yeah.
like all your research and all your education over the last, evolution of the field. I'm wondering what you think has been like the biggest change in the field, or like something like, from when you started till now, it's completely different.
Yeah, well, so in the beginning, and this is not a criticism of anybody, it's true of me, we worked with the easier behaviors, getting classrooms under control. Now it's much more teaching academic skills. And I think the two major breakthroughs that have occurred in applied behavior analysis is the functional assessment of behavior. Particularly, it's been mostly applied to self-injurious behavior. You think about that behavior, one of the most difficult behaviors you could possibly work with. And often it involved some kind of punishment procedure and all that, and that's not a complaint either, because it was better to use some kind of mild punishment technique than having kids gouging their eyes out. But then we went much further with that and did functional analysis of behavior, often able to change the behavior without without using punitive interventions. So functional analysis of behavior has broadened the interest of behavior, because people will say, well, we want to know why the behavior is occurring. Now, maybe they're saying it more like a psychoanalytic thing, but we can now answer the question, why is it occurring? It's occurring because the attention is getting, or it's occurring because she gets out of a task every time she does it. So now we can answer that question, and it's made us more broadly acceptable. I think the other thing is verbal behavior. The study of verbal behavior has been a major breakthrough. I have to tell you, I didn't pay that much attention to it early in my career. I was doing, classroom research and all that. My graduate students were taking courses with Phil Heinlein, and they were getting a lot of courses on verbal behavior. Then I became obsessed with verbal behavior. Every time I would get excited when one of my students would do a review paper on verbal behavior, and it's really if behavior analysis can't explain language or verbal behavior, it's not much of a science. But now, with the research being on verbal behavior, we are doing great things in the field of what people typically call language. So those two, I think, are the major breakthroughs in the field. The other thing is, I'm not happy about this so much, is that we've become much more oriented toward people with disabilities, particularly in the field of autism spectrum disorders. I wish we would get back to working, what my passion is, working with children of poverty. And that was Vance's passion too. And that we cannot consider ourselves to be a successful endeavor if we're only working with 2% of the population. And we have to find ways of breaking into regular education and working with children of poverty. That is much more important to the welfare of this country. And we can do both. I have no concern that if we have more people working in general education, that we'll lose people working with autism. If you put the reinforcers out there called jobs, people will fill them. And I think one of the reasons that one thing that's happened in the field is that when I came into education, and I'm an old timer here, and my doctorate is in 1970. I almost said 1870. 1970. And my doctorate is in 1970, and the emphasis then was on regular education, and we've gotten away from that, and I think we need to get back to working in regular education settings. I wish we were more welcome in those settings, but it hasn't been the case so far.
I just attended a webinar yesterday with Janet Twyman, and she was presenting some stats in terms of school districts and what socioeconomic status and the success or not success of those students were. And, it's stats that I wasn't that surprised by them, but I was shocked that there is nothing out there for that. And, it's the stats that she was presenting, even just in terms of language and how many people are exposed to language. She was saying that, people from, working professionals get exposed to, I don't know, X amount of language, but people who, aren't from a working professional, background aren't getting exposed to very much language at all. And then by the time, kids are in grade 8, the reading ability and the speaking ability is a massive gap between those with and those without.
Absolutely.
And they've done school-wide assessments for years and years and years and have found that our traditional ways of education aren't working. And in fact, they're lower than baseline after the fact, and then no one's doing anything about it. And then they're saying, oh, well, there is this really great curriculum out there that exists called direct instruction. And look, that's raising the bar, but no one's using it.
Yeah, in the 1970s, in the Johnson administration did a follow-through study comparing different interventions for teaching children in poverty, and a vast variety of kids, Appalachian, Caucasian kids, African-American kids, Latino kids, you name it, everybody was involved in there. Direct instruction procedures brought the kids up to grade level, and the government ignored its own research.
Wow.
Yeah. Yeah, and I'm a direct instruction person through and through. I love it. And yeah, I would love to get back to a lot of that stuff. And I absolutely agree that we need to be expanding the field of ABA beyond ASD.
Yeah.
Yeah, and I was a regular education teacher, and I was looking for solutions. That's how I fell into ABA, and I know how powerful the tools we have are.
Yeah. Well, regular education teachers can use them too. There's a gradual increase. You see more parents and teachers using charts and maybe additional allowances and all this kind of thing, but it hasn't consumed regular education the way it's consumed special education. I don't know how much time we have left. I'll tell you an amazing experience I had with all this. After I became promoted to full professor at Temple, I thought, when you're promoted to full professor, you're obligated to take some risk in your career. You have everything now for yourself. Now we can do for the career. So I decided what I wanted to do was to try to get the Philadelphia schools, which there's a lot of poverty in Philadelphia, to use direct instruction techniques. And I tried for 10 years and I had incredibly minimal success. There was one teacher in Philadelphia who used it and she got great outcomes, and then one special ed school, and that was it for 10 years of talking to teachers and principals. And I decided that, maybe the problem is, most of the kids in the school were children of color. I'm a Caucasian. Can I find an African American or a Latino student who could do this with me? I found one, and a wonderful person, and great student. So I recommended her to Doug Rear's program at Columbia, and he was crazy about. I can tell you her name because everything. Vanessa Laurent. That's not her married name, but that was her single name. Okay, and I tracked her down. I told her when she got accepted, okay, Vanessa, I wasn't able to break into the schools. Maybe you can. She said, that's my goal. So I talked to her just recently. I've tracked her down after all these years. And I said, have you been able to work with children of poverty? And she said, the only way I can get reimbursed for working with children of poverty is if they have an autism diagnosis. That was crushing. I mean, great that those kids get it, but all these other kids who could benefit from it are not benefiting from it.
Wow.
Okay,
Yeah.
so newly minted BCBAs, next generation of BCBAs, this is where the field needs to go.
But we have to find a way of giving them jobs so they can do it. And I wanted to have tenure in my career too. I wanted to have a job the rest of my life, but there have to be jobs in the field. And the problem is that it's the main obstacles I see to applied behavior analysis come from general psychology and from regular education. But not regular education teachers. Regular education teachers will use these techniques if they're taught them. But in academics, the regular education programs have no time for ABA, and that's true in general psychology too. If they bring up Skinner, it's only to kill him again. It's not to appreciate him. So it's great that I think we find a lot of people wanting to do this, but there have to be jobs for them.
Yeah, there's a lot to be done for sure. Most of our audience are, people just getting into the field, somewhat newly minted, even some who have been around for a while. And we always ask, what is your best advice for, a newly minted BCBA?
My best advice?
Yeah.
Well, as I said before, keep looking at the journals. Look at the abstracts of the journals, and remember, what makes us different is positive reinforcement. It's not, that's what makes us different. And as I said, the incident I had with Vance, I just saw it in action. These kids just collapsed in joy at the compliment. So I think it was his granddaughter is getting a job as a teacher, and she asked him for advice. He said, find behavior to praise. Mm. So what makes us different is positive reinforcement and research design and measurement of behavior. So keep those things in mind when you're out there.
I like that. Find behavior to praise. I think that's going to be my new mantra. I love that. Saul, thank you. This was wonderful. Such a great conversation. And it was really awesome to see you again.
Thank you. And I hope we'll stay in touch.